Hello everyone, my name is Elisa Witt and welcome to the Reach to Recovery update training for current Reach to Recovery volunteers. We'll be spending about the next hour together, and I'd like to recommend that if you don't already, to please go ahead and get a pen and a piece of paper with you so that you can take notes and jot down any questions that you have during this update training. Hopefully we'll be able to answer most of them as you continue listening, but if there's anything that's still outstanding for you, you're going to want to circle back and check with your mission delivery staff partner. With me today is Ann Abadi. Ann is a Reach to Recovery volunteer who will be helping us present the presentation today. Ann is also a 12-year survivor of inflammatory breast cancer, and she's been a Reach to Recovery volunteer for most of that time. She's also been a lead trainer in Ohio and Pennsylvania for the last few years, and she chaired the Ohio Reach to Recovery Advisory Council and has served also on the National Committee to revise the Reach to Recovery program. So I'm so excited that Anna is helping to present the presentation today, and we'll hear from her in just a few minutes. So hopefully you've gotten your pen and your paper handy, and we'll get started with the training. The most important thing that we can do on this call today is to thank you for your support of the American Cancer Society's Reach to Recovery program. As you know, Reach to Recovery plays a vital role in helping breast cancer patients get both the emotional and practical support they need while going through their breast cancer journey. Without volunteers like you, there would be no Reach to Recovery program. You have experienced much of what many of the patients that you work with have experienced in terms of possibly feeling overwhelmed, vulnerable, and alone during your time of diagnosis. And now that you've completed your own journey through treatment, each one of you is so valuable to the American Cancer Society and to the patients that we serve. You fill a role that just wouldn't be possible without your dedication to give back and serve other patients, going through something that you yourself have personally experienced. So we cannot thank you enough, and we appreciate that you're taking this time with us today to update your knowledge and to learn about some exciting changes that have come to the Reach to Recovery program. We want to let you know that with all American Cancer Society programs, we are always striving to improve the patient's experience. And so we are so excited to share with you that the Reach to Recovery program has been updated and standardized across the country with feedback and input from volunteers and staff across the country. That feedback showed that we needed to make some changes so that the experience the patients have is consistent throughout the country. Every change that we make here is, again, to service the patients so that they get the most out of this program. I want to remind everyone at this time what the mission is of the American Cancer Society. And the American Cancer Society, which has been around for over 100 years now, is a nationwide, community-based voluntary health organization dedicated to eliminating cancer as a major health problem by preventing cancer, saving lives, and diminishing suffering from cancer through research, education, advocacy, and patient service. So each one of you is an integral part of our mission and contributes to that mission and makes an impact in your community. So again, on behalf of our patients, their families, and the American Cancer Society staff, thank you, and thank you again. So what are we going to talk about today? There's some main areas that we're going to focus on, and so if you'd like to jot these down on your paper, that would be great, so that as we go through each section, if you have any specific questions, you can jot them down. The first section that we're going to be talking about is our patients. The next is the visit experience itself and what that looks like. This, again, will not be new for most of you since you're experienced Reach to Recovery volunteers, but just to understand the new standards. We're going to learn about how we currently match and coordinate visits and what that's going to look like going forward. We're going to learn about resources, what you can utilize as a Reach to Recovery volunteer, resources for yourself, resources for patients, and the different roles in the Reach to Recovery program. And lastly, we're going to talk about how we recruit new volunteers for Reach to Recovery, how we promote the program in the community, and how we provide recognition for you, our wonderful volunteers going through the program. I just want to remind you that for the vast majority of you, there really will not be significant differences in your volunteer experience. For others, you might learn about some slight changes. We want you to have a clear understanding of the program so that you can follow the new standards, and also when you tell others about the National Reach to Recovery program, you can speak accurately and consistently about what the program is. But most importantly, you might find others that you know that might want to volunteer as well. And you want to be able to let them know that this is a great volunteer opportunity. Actually, our current Reach to Recovery volunteers are our absolute best assets in finding new volunteers for the program. And we always need new volunteers for the program as it expands and continues to grow. So let's get started with learning about what the program actually is. And again, most of you know this. This is review. But just so that we're all speaking about it in the exact same way, I'm going to read this out loud. And Reach to Recovery is trained volunteers who are breast cancer survivors providing information, resource referrals, and ongoing one-on-one peer support to other people that are living or facing a breast cancer diagnosis. Efforts are made to match the volunteer to the patient by certain criteria, including diagnosis, treatment type, age, and other factors. The visit occurs either via the telephone, face-to-face, or online, and should cover all the relevant items in the visitor guide. Reach to Recovery is a standalone patient program. So that's the basic definition of Reach to Recovery, and you'll see in blue that those are some changes, and we will talk much more in detail about those changes, but we realize for some of you, some of these things might be slightly new, and that's why they're in blue, and that's what we'll talk about in great detail as we go through the program. Next, I'm going to turn it over to Ann Abadi, and she's going to talk to you about the next section, which is who our patients are. Ann?
Thanks, Elisa. Hello, everyone. As Elisa said, I am a survivor and a REACH volunteer. And REACH to Recovery is a volunteer-driven program. And so this is really your program. So it's really important that you learn everything about it and how to be a participant. Now we're going to review the breast cancer continuum and the types of patients the REACH to Recovery program serves. We have all seen the continuum, and it's been part of the training for many years, but it's actually going to become a more important part now as we go forward. Our new program standards include the Reach to Recovery goal to serve anyone, including both men and women, along the entire breast cancer continuum. As I said, we know the continuum, and the program now does it all, from facing a possible diagnosis of breast cancer, to the newly diagnosed, to people considering their treatment options, to those in treatment or who have already undergone treatment, and also to people facing a recurrence of breast cancer or who have advanced breast cancer. Most of you have probably been delivering visits to newly diagnosed and patients in active treatment. And so visits to patients along other parts of the breast cancer continuum may be new to you. Now, for that reason, let's take a look at early support and recurrence in greater detail. Early support is appropriate for anyone with a personal concern about breast cancer. This may include anyone who has found a suspicious lump, had a questionable mammogram, or has a biopsy scheduled but hasn't yet had a breast cancer diagnosis. Or it might be someone who has a diagnosis of breast cancer but has not yet decided on the type of surgery. Or it could be someone with a diagnosis of breast cancer who's decided on the type of surgery but hasn't had the surgery yet. As you know, at this stage in the cancer continuum, it may be helpful to talk with people who have experienced different types of treatment. Patients considering multiple treatment options could choose to have a visit with a different volunteer who had different types of treatment. In early support, if you know the patient has not made a treatment decision, remind them that they may want to talk to a different visitor who has had a different experience with treatment that's different than your own treatment. We'll talk more about this when we discuss the process flow for REACH visits later in this program. Moving on to recurrence and advanced stage disease, some areas of the country already offer visits for patients who have had a recurrence or advanced stage diagnosis. Obviously, recurrence and advanced stage cancer raises special concerns. Specialized training to prepare REACH visitors for these visits will roll out later in 2014 or 2015. Divisions should continue following the way they currently match these patients until the nationwide recurrence training is available. These visits will be made by specially trained REACH to Recovery volunteers who have actually had a breast cancer recurrence or were diagnosed at an advanced stage. That is, with metastasis or spread to other areas of the body. And these volunteers will also attend an additional training on recurrence and advanced stage breast cancers to help them with their visits. As I said, the training for recurrence and advanced breast cancer visits will be rolled out nationwide later this year or early next year. Until this training is available, any volunteers that already have been performing visits to support recurrence or advanced stage cancer can continue to do so. If it's your preference not to do certain types of visits, that's always okay. Just discuss this with your coordinator or local staff partner so they can honor your preferences when coordinating visits and making assignments. And now, back to Elisa to cover the visit experience.
Thank you, Anne. So, let's talk about what the visit experience is like. Moving forward, REACH visits may be provided in 3 different ways, either face-to-face, on the telephone, or online, such as email. You are all very familiar with face-to-face and telephone types of visits. As a reminder, face-to-face visits should always take place in a public location and not at your home or the patient's home. Email visits, however, will be new for many parts of the country. This type of visit is intended to meet the needs of the patient who prefer to communicate online and or have difficulties fitting the REACH visit into their busy schedule. Email visits should only be utilized if that's the patient's preference and if they desire to communicate that way online. And so visitors should always check with the patient to see if email continues to be their preference. So in other words, if they ask to be contacted via email, at any point they can change their mind and request a telephone or a face-to-face visit. So just so you know, this is based on the patient's preferences. And we realize that many of you may not be comfortable in providing email visits. And if that's the case, just let your coordinator know so they know not to match you with this type of visit. If you do feel comfortable providing visits via email, you should know that there will be several tools included in the new updated volunteer manual that will help visitors provide these online visits. Those tools include things like an email template with suggested language to include in the introductory email to the patient, as well as a list of specific email confidentiality standards and reminders. And the new volunteer manual, if you haven't seen it yet, will be available soon on the Volunteer Learning Center, which hopefully you already registered on when you signed up to attend this webinar today. I want to go over now what the first contact will look like. Now that we've covered the 3 different possible types of visits, whatever type of visit, whether it's online, in person, or over the telephone, should cover the same basic aspects. So once you agree to accept a visit opportunity with a patient, it's very important that you contact the patient within 24 to 48 hours of receiving the visit request, so the patient isn't waiting too long to get the support that they need. Obviously, as you all know, having been there yourselves, that first contact the visitor makes with the patient to introduce themselves is really important so the patient isn't waiting anxiously and wondering when you're going to call. So just that very first contact, whether it's to set up your visit or to actually hold your visit if it's appropriate, that should always be made within 24 to 48 hours. And during that first contact, you'll introduce yourself as the REACH visitor and schedule that time for that first REACH visit, unless they're willing to do it right then and there, and you can too. If the patient isn't available when you try to reach them, you can leave a message. But it's important when leaving a message not to leave too much information on the patient's voicemail or in a message. The message should include only your name, the fact that you are a volunteer with the American Cancer Society, and your phone number if you feel comfortable leaving it. It's important that you not mention Reach to Recovery, since that's easy to Google and show that it's a breast cancer support program, and we want to make sure that we hold the patient's diagnosis in strict confidence, even with people in their household. So just to give a reminder again, you want to leave your name, the fact that you are a volunteer with the American Cancer Society, and your phone number. It's best for you to provide your personal contact information, either your phone number or an email, so that the patient can get back to you. However, you should be mindful in how often you give your phone number out and make every attempt to keep that private until you establish contact with the patient and can establish some ground rules. So visitors are asked to make 3 call attempts when they try to reach a patient if you can't reach them at first. And then we do have some more information later in the program today about what to do if you can't reach the patient with 3 attempts. So just to talk a little bit more about what should be included in that first contact, you want to, of course, introduce yourself as an American Cancer Society Reach to Recovery volunteer. That's when you're actually speaking to the patient, not in a memo or a message. So you want to include that and the fact that you're a breast cancer survivor. You also want to establish a solid sense of rapport with the patient. You want to use your smiley voice, just like I'm doing right now. You can tell I'm energetic and upbeat. You want to establish that rapport with that patient. You want to remind them that this service is free of charge, that it is a patient service program free from the American Cancer Society, and that you are volunteering for that. I know that sounds obvious to all of you who are familiar with Reach to Recovery, but sometimes our patients don't understand that this is truly free and that we're not trying to solicit donations or get them involved in any kind of breast cancer walk at this point in time. We just want them to know that this is purely a service to support and help them, that it's completely confidential, and that there are no strings attached. We want to set that tone right away. If it's already been decided, you want to, unless it's already been decided, you want to give that patient that choice, whether they prefer a phone visit, an email visit, or face-to-face if that's possible for you. And then ask the patient if this is a good time to talk, and even if you've already made the appointment, you want to confirm that with them just in case something changed, or give them the option of rescheduling if something has come up and they're not comfortable spending the time that you need for that first visit. Your first contact sometimes often does lead to your first visit, and that's fine. So you want to just be prepared. Sometimes you're going to call to set up that first visit, but it's going to turn into that first visit right then and there. So just get ready for that when you make that first patient contact, just in case it's a great time to get that visit in. I also want you to be familiar with the new Reach to Recovery visit guide. And whether it's your first contact, your first visit, or a follow-up visit, this guide will really help you in making sure that you complete the visit and that you follow the guidelines for Reach to Recovery. Most of you are probably familiar with some guidelines or process from your former training in Reach to Recovery, so that's great and that's fine. For others, this might be a new concept to actually have a formal guideline and a checklist for visits. So there is a little bit more structure for some of you, but we hope you'll become familiar with this structure and understand that the reason we did that, again, was to improve the standards of quality with our program and make sure that the visits reflect as much as possible some basic requirements. We ask that you walk through with us on this guide to reflect on how the things in this guide will benefit your patients. And we of course realize that each visit will be unique and that the checklist is just a guidance. You still want to use your judgment and your natural abilities of communication and talking with someone, as far as what elements are important to deliver to that particular patient and which ones may not be appropriate, but the guideline will hopefully help you not to forget any of the important elements. We have some basic definitions of what a visit entails, and those are highlighted in the visit guide. And so we want to make sure that if for whatever reason the patient is not ready, willing, and able to really go through most of the elements in the guide, then that's something you're going to want to note in your paperwork when you submit that you've actually contacted the patient, that maybe it wasn't really a complete visit. And that's just fine, but we just want to have a way of standardizing what a visit is and what a visit isn't. So you could take a moment, if you haven't already received the Reach to Recovery Visit Guide, make sure you request a copy of that. You're going to want to pull that out and really take a look closely at that checklist. You'll be able to find a copy of that guide on that volunteer learning website that I referred to earlier, and that we'll tell you more about later in the presentation and how to access that if you haven't been on that. And if you'd like to see examples of using the checklist, there's also a new nationwide training that's available on demand called an e-learning, and the name of that training is just called The Visit. So it's a video that goes through the checklist and what constitutes the basics of a good Reach to Recovery visit. And that's also available on the Volunteer Learning Center as an option for you if you think that would help you go through the basic elements of a Reach to Recovery visit. Now I'm going to turn it back over to Ann, and she's going to talk a little bit more about that checklist.
Thanks, Elisa. Now as I go through this, all the elements in the checklist are listed there on your slides as I am talking at them. Remember that the visit should cover all pieces which are relevant to the patient at the time. Please use your own judgment as to which pieces are relevant for your visit. In most cases, an entire visit will typically last 30 to 45 minutes. Remember that the needs of the patient really drive the visit. We're always concerned about the needs of the patient. So we start with the introduction. Introduce yourself as an American Cancer Society Reach to Recovery volunteer and a breast cancer survivor. Assess the patient's readiness to talk to you at the time. You may need to set a better time later if they're busy or aren't in a quiet place or ready to receive the information. And then remind the patient that this service is free and that their participation is voluntary. Next, discuss patient and volunteer confidentiality. Let the patient know that as a volunteer of the American Cancer Society, you are committed to maintaining the highest level of confidentiality. And then establish rapport and make sure the environment is safe. Ensure that the patient is able to either meet or take the call in a private, quiet location with few or no interruptions so they can speak freely. Make sure to establish a connection and environment of trust and genuine interest at the beginning of the visit. If you can't do that, it might be time to call back or arrange another time to meet with the patient. Remember to use nonverbal communication skills like tone of voice, especially over the phone, or body language if you are in person visiting the patient. Ask the patient what is most important to them to talk about today. And then discuss the goals and expectations of the visit. Your goal is to provide them with support and a confidential and safe place to talk about their concerns. They may have other goals. Make sure you check with them about that. You should have a notebook on hand as you're making the visit to take notes, so you can remember things that you may want to follow up on, and then you won't have to interrupt the patient constantly while they're doing their sharing. Just remember to keep that notebook and any of your notes in a safe place to maintain the confidentiality of the patient. Moving on, for most of you, this is a review of what you know so well, but let's go over just to get the high points. First, make sure that you understand the patient's breast cancer experience and needs. You should ask probing, open-ended questions to fully comprehend where the patient is on the breast cancer continuum. Open-ended questions are not answered with a yes or no, typically. So, have you had your surgery is not an open-ended question. Use clarifying questions such as, what I heard you say is your surgery will be delayed. Is that correct? And that's obviously a question that's a little bit more open-ended, and they'll have to say a little bit more about it. This ensures that you have understood the patient's comments or requests as well when you use those clarifying questions. Also, give them a chance to elaborate more after you reflect back like that. Your clarifying question may lead to more information from them or more questions that they may have. Give the patient the opportunity to express their feelings about what is happening. And as you do this, remember that you should be practicing active listening. We should have all learned about active listening in our initial Reach to Recovery training. Active listening means focusing on them and showing your understanding of what they say, seeking as much clear understanding as possible with your questions. Collect enough information from the patient to be able to recommend resources for them during your call. You will also respond to questions and concerns. Answer questions of fact, but remember, never give medical advice or personal opinion. I hope we've all learned how to dodge the question, who was your doctor? I know I've found several creative ways to get around that question with patients. Be comfortable letting the breast cancer patient know if you're not sure how to answer their question, but reassure them that you will find out and get back with them or find them additional resources. You point them to lots of resources, which we'll be telling you about later. Next, you should review the information packet. All patients should receive this packet before you call them, but you want to confirm if the patient has received the packet. If not, ask them to verify with the Patient Service Center and provide the 800 number again. And that number is 1-800-227-2345. If the packet was received, you can review the packet with the patient and address any questions or concerns. I'll be talking more about the information packet towards the end of this presentation. Then, you want to review the resources. Try to offer a minimum of 2 ACS resources that fit the patient's breast cancer experience, concerns, and questions. This could include ACS patient programs and services, written materials, online tools, or local resources. Remember that not all ACS patient programs and services are available in every community, and that some people are not comfortable with online resources. If the patient appears to need additional information or resources, encourage them to call the ACS toll-free number. And here it is again, 1-800-227-2345. We know that Reach to Recovery got started with women teaching arm exercises to patients. Well, Reach is still a little bit about arm exercises. Of course, this is only for pre- or post-surgery patients. You should encourage pre- and post-surgery patients to ask their surgeon about arm exercises to improve their range of motion after surgery. Please be very careful with this because the decision about something like that is truly up to the surgeon. And also remember that there is an ACS booklet that you can recommend that they request when they ask for additional information. Finally, is concluding the contact. You briefly review your understanding of the patient's needs. Give them information on how to contact you. If you offer a follow-up visit, set the date and time as appropriate. Ensure that they have the ACS's toll-free number and also that they know about the cancer.org website to get information and resource referrals. Stress that there is always someone to talk to at the toll-free number 24 hours a day, 7 days a week, even if they're looking just for support. If they're awake at 3 a.m., there's always a friendly and knowledgeable cancer information specialist there for them. I think I may test that someday. And of course, end the conversation on a supportive and empowering note. At the end of the first visit, the patient and visitor should discuss if the patient would like a follow-up visit. That could be, the patient may have already said that they only want the one call or they're really not that interested, but make sure that you discuss it with them, because perhaps after their call you've encouraged them to get additional help. As you know, sometimes additional visits are needed depending on the individual you are working with and their needs. If you provide more than the first visit, the new Reach to Recovery process will allow you to provide and report back on up to 4 REACH visits total. That's your first visit and then 3 subsequent visits. If someone is needing a lot of support, they can be encouraged to call the toll-free number to find a long-term support group, hotline number, or even counseling if that is appropriate for the patient. These 3 additional visits will also follow the visit guide, specifically the follow-up visit section. The areas to cover are the same as for first visits. They're usually more brief and tailored to be relevant to the situation and the questions the patient may have. If a patient has a change in their cancer situation or needs additional support and additional visits beyond those first 4, they should contact the National Cancer Information Center to request another REACH visit. If they would like to be matched back with the same volunteer visitor, they can request that specific visitor and the coordinator can manually match them together again. Each visit, regardless of if it is a face-to-face, phone, or email visit, counts as a visit as long as the relevant items on the volunteer visitor checklist are covered. If the patient meets with more than one Reach to Recovery volunteer visitor, the same policy applies. So basically they can have up to 4 visits with each visitor. And now Elisa will cover the new reporting guidelines.
Thanks, Ann. And I have called that number at 3 a.m. when my mom got diagnosed, so check it out. It really does work. So now we're going to talk about reporting visits. And just getting back to that slide there, visitors should report their visits after each visit using a completed visit information form. The form is also available now on the new Volunteer Learning Center, both as a standalone document and also you'll find it inside the new Reach to Recovery Volunteer Manual. We highly recommend that you have a visit information form ready, have several of them printed out, so that when you get a call from a coordinator, you can fill out the patient details directly on the form. After the visit, if there are additional pieces of information you learn, you can fill in other sections of the form before returning it. So in other words, if a patient gives just a few details that help with the match, but then you learn a lot more about their preferences and other details that weren't filled out originally on the form, you can go ahead and fill those in if the patient offers it. You're also going to include some basic information about your visit, and then you can either email, snail mail or US mail, or fax the form back to the Centralized American Cancer Society Business Center. And the name of that business center is the ACS Shared Services Business Center, and that's printed clearly on the form. So right on the form there are instructions for where to email it, where to mail it, or where to fax it. Obviously, if you're going to email it, you need to have a scanner and scan the form in, and then you can attach it to an email. Regular mail, you just pop it in an envelope, and the address is right there on the form. And there's also a fax number if you have a fax machine and you want to fax it in, whichever way is more convenient for you. However, it's important that you report your visits within 5 days after the visit takes place. And these are regular days, not business days. So in other words, if you have your visit on a Friday, then Saturday, Sunday, Monday, Tuesday, Wednesday, you're going to want to get that form in by Wednesday of the following week at the latest. This is important so that we can track and ensure that the service was actually provided as we promised to the patient. And it's also important to know what other services have been provided to the patient in the event that they call back with additional needs. So knowing what a patient has already requested or already received helps the American Cancer Society better understand and serve that particular patient. If you're unable to reach the patient and you try that on 3 different days and different times of the day, and you're never able to reach the patient, and you're not able to leave a message, or the patient does not return your call, then you can use that same form to complete to say that you have not been able to reach that particular patient. It's also very important to let us know, again, within 5 regular days, if you have tried on 3 different times, at 3 different times of day, hopefully, and you've not heard back anything from that patient. Then you're going to want to submit that form and kind of document, that you tried on different dates and times so that we know what the status of the visit is. Please ensure that you are reporting your visits on a timely manner so that there isn't unnecessary follow-up generated on the part of American Cancer Society staff to find out what happened with the visit. If we have any volunteer coordinators joining the training today, then we want you to know how this form impacts your responsibilities, and we'll take a deeper dive into that and how you intersect with that form as a coordinator when we talk about the volunteer coordinator role in just a few minutes. Next, I want to talk a little bit again about privacy and confidentiality. And we know as experienced Reach to Recovery volunteers, you're well aware of our policies regarding privacy and confidentiality. However, since this is your annual update training, it's important that we review these to make sure that we're all reminded of how important privacy and confidentiality are with Reach to Recovery and all American Cancer Society patient programs. It's important to keep your voice low when discussing personal information. You want, of course, be in a private location. You don't want even your family members to hear what you're discussing about a patient's personal experience. So you want to be in a private, secure location, and you want to avoid having any conversations about a patient even after you're off the phone with them. You're not to have any conversations about the patient with other people. Avoid using the patient's full first and last name. If you do need to write their full first and last name, you want to keep that paper secure and confidential and covered up on your desk at all times. You want to have only you as the visitor and the patient on the phone at the same time with you in a private, quiet location. So nobody else should be on the phone. This should be a private and confidential conversation between you and the patient. There are some confidentiality reminders in the Reach to Recovery manual, which again is on that Volunteer Learning Center website. There's definitely a list of email privacy guidelines and email templates that you're going to want to look at should you choose to be accepting of email visits with patients. Again, that's your choice if you're comfortable with those types of visits or not. It has a standard confidentiality statement that you're going to want to include in the body of your email in that email template. The volunteers for Reach to Recovery should never copy or forward an email to or from a patient to anybody else. Again, this is a one-on-one secure conversation, just like if it's on the phone. Use the patient's email only for Reach to Recovery purposes. You should not retain that email address or use it in the future beyond your Reach to Recovery visits that have been agreed on between you and the patient. And you should ensure that the email is being sent to their personal email address, not their business email or a shared email account. So that is, again, all covered in your Reach to Recovery manual. If for any reason you inadvertently experience a breach in privacy, for example, you email the wrong person by accident via a typo or something like that, then you are expected to let your volunteer coordinator know right away that there has been a concern about a breach of confidentiality. The coordinator will call our American Cancer Society hotline, again, just to follow up and make sure that it is documented that some patient information might have gone in the wrong direction. Don't worry about it, but let us know right away so that we can keep our protocols and our confidentiality things are in place. This process can be used if you absolutely know of a breach, or even if you simply believe there is a privacy issue or concern. Then you're going to want to let your coordinator know, and your coordinator will know what to do with that information and where to take that. well, actually on your screen is the ethics hotline. That is a number that the Reach to Recovery coordinator will be using to report that breach and confidentiality, that number you see on your screen. So if you're a coordinator, you're going to want to use that number, and if you're a visitor, you're going to want to let your coordinator know, and he or she will report it to our ethics hotline. Next, we're going to talk about how we do matching and coordinating of visits. While matching a volunteer to a patient is always based on certain specific criteria, as we re-standardize the Reach to Recovery program based on feedback from both volunteer visitors, patients, and staff throughout the country, we have come up with some basic criteria that are necessary to match a patient. Basic information. Matching 100% of the criteria listed by the patient may not be possible, but this is the basic information that we always collect so that we can do the best match as possible. As you all know, a good match between a patient and a volunteer visitor definitely facilitates more effective support for that patient. So we do our best to match on as many of these variables as possible, but it's never, well, I shouldn't say never, it's frequently not perfect. But moving forward, as we start these new standards, which will take into effect, all the standards will be in effect in place starting September 1st, there will be this minimum criteria of matching information that must be documented before a REACH visit request is moved on to the coordinator. So this basic information that we're going to try our best to collect all of from the patient includes the type of surgery and treatment the patient is expecting, if they know that, what year they were born, so we know their age, whether or not they're a male or a female, what their race is or ethnic background, what their primary language is. And cancer stage could also be collected if the patient offers that, but if we don't have it, a match will still be made. If any additional information is available on a patient that may improve the match, that will also be passed along to the coordinators. That information, if the patient offers it, could include the patient's ethnicity, their marital status, the number of children they have, their religion if that comes up and it's important to them, their sexual orientation, again, if that is offered by the patient and that's important to them. That question about sexual orientation and religion and those kinds of things, those are not asked directly of the patient. But if the patient brings it up and offers it, then that information will be provided also to the Reach to Recovery coordinator. So these are the basic pieces of information, and again, more information could be collected and provided as it is offered up by the patient. We want you to also know about the American Cancer Society's centrally located Patient Service Center that coordinates patient services nationwide. It's located in Austin, Texas, and it is called the Patient Service Center. Sometimes we abbreviate it as the PSC. That Patient Service Center arranges for services just like Reach to Recovery, also transportation, Road to Recovery, lodging for patients who receive cancer care, and all other society programs and community resources that could benefit the patient before and after their treatment. That Patient Service Center is in the exact same building that houses our National Cancer Information Center, which sometimes we refer to as NCIC, but it is the National Cancer Information Center. And that is the place that the public typically calls for all things American Cancer Society, such as cancer information, general inquiries about our events, such as Making Strides Against Breast Cancer Walk or Relay for Life, and other programs. And that phone number, as we've said a couple of times, but we can't say it enough, is the 1-800-ACS-2345 or 1-800-227-2345. And that is our main core number for all things ACS, and it is staffed 24 hours a day, 7 days a week, and 365 days a year. The Patient Service Center has a specialized coordination team dedicated to working with Reach to Recovery volunteer coordinators. That team communicates visit request details to the coordinators and initial outreach to the Reach to Recovery volunteer visitors if there is no coordinator in that area. And that is the team that if the patient Reach to Recovery request comes in and it is incomplete, it doesn't include that basic information we need, they reach out and call the patients and collect the rest of that information. So let's take a little bit closer look now at what the Patient Service Center role is with specifically Reach to Recovery. The Patient Service Center supports the REACH visits by doing the things that I just said, which is passing the visit request to the coordinator when the matching criteria is available, contacting the patients if more information is needed. But also what they do is if they can't reach the patient, say a doctor's office faxes in a referral form saying this patient would like a Reach to Recovery visit, and it doesn't have enough information, and they reach out and try to reach the patient at least 3 times, then they also send out a letter to the patients to let them know that we're unable to contact them. The Patient Service Center, as I said before, is the main hub for coordinators to receive the REACH matches from before they match them up with the volunteer visitors. And they always attempt to, again, reach those patients back to get a complete information from the patient before the match is passed along. Again, in areas where the volunteer coordinator role is empty, then the Patient Service Center will also temporarily assume the coordinator role and make those matches directly with the volunteer visitors. The role of the volunteer coordinator. So if we have coordinators listening in on the line, this section talks about your role. And also if you're a visitor, we want you to know how we work with your coordinator, and so you can understand the entire process. So the Reach to Recovery coordinator is responsible for the management of the volunteer visitor activities, including both the matching and reporting of the Reach to Recovery visits. So if for some reason you're not getting those forms turned in within that 5 days, you should be followed up by your coordinators. Coordinators should be following up to make sure that paperwork is turned in a timely manner. The coordinator receives the request for the Reach to Recovery visit and appropriately monitors and assigns these visits to active volunteer visitors, keeping in mind the match criteria. They'll match the patient with the visitors that have the closest matched, and any additional preferences, such as if the patient only wants to have an email visit, or the patient wants to meet face-to-face, or the patient only has time for phone. So those kinds of details hopefully will be collected. If we don't have that information, that's what you're going to check with the patient on the first visit. They begin coordinating each visit as soon as possible. So coordinators' time is of the essence to get that visit request matched with the right visitor. And they have a maximum time limit of 48 hours to coordinate those visits. Many coordinators maintain a log of patient-visitor matches for follow-up purposes if the visit report isn't turned in a timely manner. And we want to encourage you to still do that. We need your help in making sure that the paperwork and the matches happen in as fast a manner as possible, because those patients are waiting, as you know, and may be very anxious. The Reach to Recovery coordinator role is a 2-year renewal term. So when people volunteer to be a Reach to Recovery coordinator, they are asked if they can commit to a 2-year volunteer service. Because again, for continuity and program management, it helps if we can have coordinators who are experienced and stay in the role for a good period of time and not have too many revolving coordinators. For all current coordinators, you can touch base with your local staff person to discuss with them when your 2-year term is up for renewal. So if you've already been coordinating for a while, you're just going to want to talk with them about that renewal. And that's certainly not a problem to continue coordinating longer than that 2 years, but we want to make sure that you understand the process going forward and that we have this minimum expectation of 2 years. The Reach to Recovery coordinator, as I said before, collaborates with staff to ensure the accuracy of the visits, the visits are complete, that the forms are being filled out, and that the documentation gets tuned in smoothly and quickly. The volunteer coordinator also works with volunteer visitors as needed to resolve any issues or any requests or any things that are not flowing smoothly. And that's really the idea, is to keep the requests getting fulfilled as soon as possible and to keep the reporting coming back as soon as possible. The staff partner from the American Cancer Society, who is called the Mission Delivery Specialist, will provide coordinators with an updated list of visit requests that we have found do not have turned in paperwork completed. So there will be an exception report that comes out that the volunteer visit coordinators will get that shows them if any forms haven't been turned in, and then they in turn will follow up with the visitors to find out what's going on with those forms. Maybe the fax number had a typo in it, or maybe something's going on where the mail, God forbid they get lost in the mail, but just following up, making sure that we can report accurately and timely on what happens with the visits. Next, we're going to talk about the process from start to finish. This is going to be a high-level overview of what happens from the time the patient requests a REACH visit to the time the form is completed. A REACH visit can come to the American Cancer Society in a variety of ways. Examples include that National Cancer Information Center, that 1-800-ACS-2345 number, hospitals, doctors' offices, nurse navigators. We get them through our cancer.org website. We get them through patient navigators that the American Cancer Society has embedded in some programs and facilities. We get them through our local offices. There's lots of different ways that these REACH to Recovery requests come in. Once a request comes in, if the minimum necessary information for the patient is available, then the Patient Service Center immediately passes the information directly on to the coordinator. If the minimum necessary information is not available, then the Patient Service Center, as I said before, will attempt to contact the patient and gather the additional information before they pass on the visit request to the coordinator. The Patient Service Center, if they can't reach the patient, will also send the patient a letter saying they're unable to contact them. If they do reach the patient and the visit information is complete, then they also, at the time they pass the visit on to the coordinator, mail or email the REACH to Recovery information packet to the patient. So if the patient prefers to get it via email, that's how they'll get the information. Otherwise, they will get it in the U.S. mail. The volunteer coordinator then matches the patient with the visitor and contacts that visitor to offer the visit opportunity. If the visitor accepts the visit opportunity, then they make the first contact, as I said before, within 24 to 48 hours with the patient. If for some reason the visitor cannot accept that match, then the coordinator moves on to the next match visitor to offer the visit opportunity again. Again, there's a maximum time limit for the coordinator, or if it's the Patient Service Center fulfilling that role, of about 48 hours. This is just one approach to how a volunteer coordinator might match a visit with a patient. Some coordinators use email to match multiple visitors to a patient at the same time to speed that process. It doesn't have to be over the phone. But the visitor is asked to contact the patient once again within 24 to 48 hours of accepting the visit, and then sending that completed form to the Shared Service Business Center, again, which is listed on the form. So that's that process, and now I'm going to turn it back over to Ann, and Ann's going to talk about different resources and roles within the REACH to Recovery program.
Thanks, Elisa. So I'm going to look at the resources that are available to both patients and volunteers, and all of the roles that we've been put in place to make REACH to Recovery a successful program. Some of this is review, but we have some new roles to talk about as well as we go through. Starting on September 1st, all REACH to Recovery patients will receive a REACH to Recovery patient information packet. This packet has been standardized to include a Welcome to REACH letter introducing the patient to the REACH to Recovery program and the American Cancer Society. It will also include the booklet for women facing breast cancer, and you can see a picture of it there on your screen. Most patients will receive this packet in advance of the visit that you will have with them. However, depending on multiple variables, some packets may not arrive until after the visit takes place. By the way, for men with breast cancer who seek out REACH program peer support, they will receive a dedicated intro letter directed at men and a supporting document called the Breast Cancer Overview. Some of you might be familiar with providing a kit to your patients when you visit them. The contents that have been sent in these kits previously vary greatly depending on where you were across the country. We realize this is going to be a change from the materials you have been providing and what is in the new standardized information packet. There are many reasons based on Facebook for why this packet was redesigned to include only these 2 items. We made sure the patient packet going forward is simplified so the contents were not overwhelming for the patients. Also, that booklet for women facing breast cancer is comprehensive and covers most topics important for breast cancer patients in just that one booklet. It also allows for the most current information to be easily shared with breast cancer patients. It's also important to know that the National Cancer Information Center and the Patient Service Center, as we have heard, both in the same building in Texas, will send the patient additional materials and resources as needed. Many patients will have already received those additional materials as well. The ACS staff are trained to ask background questions so they can provide a tailored approach to materials and resources the patients may need. As we know, a lot of this happened during the REACH visits, and we were the ones that requested some of the additional materials. It will be nice now that the patients can actually have those materials in hand when you're discussing them and you can refer to them. The REACH packet. Yes.
I'm sorry, I'm interrupting you. I apologize,
right.
But since we're recording, a word came out of your mouth that I think you didn't realize, and you said it was based on Facebook. It's actually based on feedback.
Oh, I'm sorry.
Yeah, it's all right. I know sometimes we say words and we don't even hear it ourselves, but I don't want anyone to think that it was based on Facebook. It's based on feedback.
Feedback. Thank you, Lisa.
You're welcome.
That way in my notes.
I'm gonna let you continue. Thanks,
Okay.
Ann. Take care. Okay.
The REACH packet will be ordered by the Patient Service Center at the time they communicate the REACH to Recovery visit request to the coordinator. The packet will be sent via postal mail or email, depending on the patient's preference. If the Patient Service Center discussed other materials with the patient, such as other booklets, those will be sent at that time as well. So the information packet includes, as it says on your screen there, the introductory letter that talks about REACH and explains the patient should expect to be contacted by a visitor soon, and provides a brief overview of ACS and its services. And it includes the For Women Facing Breast Cancer booklet, and that has sections on what is breast cancer, before and after diagnosis, the healthcare team, reconstruction, coping, and resources. By the way, there's also an English-Spanish bilingual version of the booklet, and that will be sent to Spanish speakers. And please note that because the For Women Facing Breast Cancer booklet covers topics throughout the breast cancer continuum, this same information packet will be sent to all REACH to Recovery participants regardless of their cancer stage. As a volunteer, we suggest that you become familiar with the materials we have available so that as you're meeting with your patients and they express a need, if there's a material item we offer that they could benefit from, you will know more about what is available. You can find all the items listed on cancer.org, and there will also be a list of resources and information for breast cancer in the REACH to Recovery Volunteer Manual. Now we have to talk about bras, prosthesis, and pressure pillows. Now that you know what's going to be in the information packet and what it is, you might be curious about the bras, puff forms, pressure pillows, which also used to be in the kits that we provided to patients. These items will no longer be sent as part of REACH to Recovery. That doesn't necessarily mean that they're no longer available to breast cancer patients. Bras, temporary prosthesis, or puffs, which we used to call them, and pressure pillows will just no longer be offered as a standard part of the REACH to Recovery program. In the past, as many of you know, in some parts of the country, we provided breast cancer patients with some of these items. Going forward, it will be up to the local region if they continue to offer these to patients. They would just be offering them outside of the REACH to Recovery program. We also know that some areas have recently discontinued sending these items to patients. If your area has provided these items in the past and you have questions on how they will be distributed moving forward, please contact your local staff partner for clarification. Now, we still want patients to be able to get access to these items if they need them from us. The American Cancer Society has resources where we can refer patients. When appropriate, the National Cancer Information Center or the Patient Service Center will provide breast cancer patients with the American Cancer Society TLC or Tender Loving Care Catalog, which has information on wigs, prosthesis, bras, and other items at a not-for-profit cost, as well as lists of where those items are available within a patient's community. For more information on the TLC catalog, you can visit, it's down there on the bottom of your screen, tlcdirect.org. Well, since you're here at the webinar today, you must have created a profile at the Volunteer Learning Center when you registered for this Reach to Recovery update training. If you've not seen the new site or explored it, please check it out. The Volunteer Learning Center is an American Cancer Society training resource designed exclusively for all ACS volunteers. Volunteers can use the site to access training programs that will help prepare them for their volunteer roles. Having one centralized site gives all ACS volunteers an up-to-date and consistent learning experience. The training sessions on the site provide you as volunteers with functional skills so you can be successful with your role. The site also helps educate volunteers on other American Cancer Society programs and events, and further develop their knowledge as an ACS volunteer and representative. We really encourage you to explore the site and feel free to view any of the training sessions that interest you. We suggest that prior to taking additional training sessions, you check with your staff partner to see if that particular ACS program or service is available in your area and if they need additional volunteers. You might also be interested in viewing some of the new training curriculum for new REACH volunteers. One of the e-learning sessions is specific to the REACH visit and goes into more details on the guide and checklist. This curriculum can be found by selecting the REACH to Recovery New Volunteers subcategory under Find Courses that's available on the menu after you log in. If you've not explored the Volunteer Learning Center or you need help getting more comfortable with it, you might consider viewing the Getting Started video on the home page of volunteerlearning.cancer.org. You may also reach out to your local staff partner. As we roll out additional training, it will also be available on this site. There are also some great program support materials available on the Volunteer Learning Center to print or reference. Right where you sign up for this webinar, there's a list of webinar sessions. There's a webinar evaluation form, course completion certificate, and also the Reach to Recovery Volunteer Manual, Reach to Recovery Completed Visit Information Form, and the Reach to Recovery Visit Guide. Now the Reach to Recovery Volunteer Manual is available either for print or download, and this is the new version of the manual. So please get rid of all your old copies you might have. I know I had kept several different versions of the manual around just to refer to in the past, but I'm going to throw them all away and just have the new manual online. After this training, the new REACH manual will serve as your reference, and it's some great additional information. Another great thing that's going to be on that site will be a list of questions and answers from all of these volunteer update sessions we're doing this summer, and that will be posted in a few weeks into the Volunteer Learning Center. So when you have written down your questions during this session, you may want to refer to that list of questions and answers, and perhaps your question will be answered there. If you need a hard copy of any of these materials and you're not able to print them, please contact your local staff partner and they can send you what you need. So one more time, we're going to go over the staff and volunteer roles just to make sure we're all clear on this. We all play an important role when it comes to supporting our patients. There are a few important changes to staff and volunteer descriptions with the new standards. We're going to take a moment to review these, and you can find the details in your volunteer manual. First, we'll talk about you, the volunteer visitor. The volunteer visitor role description is not changing, but we'd like to highlight some key things about it. Remember that visitors need to be out of active treatment for a minimum of 1 year. We want to assure that the REACH volunteer visitor is emotionally and physically healed. It also allows enough time for the volunteer to separate from their own breast cancer experience, and the visit experience can be focused on the patient's situation. And one new change is that the new volunteer visitors do not need to obtain permission from their doctors to volunteer. This could be a significant change in some areas of the country where you had to have written permission. Moving forward, all volunteer visitors will need to take an update training on an annual basis. This particular update training you are joining today is focused on program changes and building consistency within the REACH to Recovery program nationwide. In future years, this training will include program updates and privacy training. However, the main focus, as it has been for a long time, will be on breast cancer treatment updates. I know that's been the most popular part of the program whenever I've done training. Volunteers will be notified about 1 to 2 months prior when it's time for their annual update training. This training will be standard across the entire ACS. By the way, we're also encouraging the recruitment of bilingual visitors to better meet the needs of some of our patients. So you may want to be on the lookout for new volunteers who could be bilingual. Now, the volunteer coordinator. We discussed already the exact role of the volunteer coordinator. If you have more questions or a special interest about this role, please contact your staff partner to find out more. And that leads us to the staff partner. The new title of your local staff partner is Mission Delivery Specialist. You see one down there in the right-hand corner of your screen. They're there to offer you guidance and assistance in your visitor coordinator role. They are also always looking for new volunteers to fill REACH and other volunteer roles as needed. If you're unsure who your staff partner is, you can check with your coordinator, or you can call the main 800 number, 1-800-227-2345, and a cancer information specialist would be happy to get you connected with your local mission delivery specialist staff partner. Now here's some totally new roles. There will be a national trainer role. Several national trainers will be appointed. The details on the recruitment and selection process are still being determined. We do envision the national trainer volunteers to come from our current list of volunteer area trainers. These trainers will be responsible for facilitating national webinars and teleconferences. There will also be a mentor role. This mentor role is entirely new. It will be rolled out later in 2014. The mentor will work with new volunteers and serve as a resource for existing volunteers. All new or current volunteer visitors will have the option of meeting with a mentor if they wish to do so. We're still working out the details of some of this, so more information and communication about these roles will be coming out later this year. Now we know, and we've heard from various parts of the country, that volunteer visitors may become underutilized over time. Some of you may not have received a call or a connection in quite some time. You may not have been called to make a visit in some time. And that's because the longer the time since the volunteer's own treatment, the less likely they are to be a close match to a current breast cancer patient due to the significant changes in treatment we've seen over the last few years. If you feel this is the case for you, please contact your volunteer coordinator or staff partner so you can discuss this with them. We really, truly value you as a volunteer and want to make sure you have the opportunity to be fully utilized within the REACH program or other areas of the ACS if you're interested. Now we're going to go back to Elisa for some additional new features of the program.
Great. Thank you so much, Ann. And thanks to all of you for hanging in here. I promise we're almost done with this update training. I know it's a long time to be on a call, so we really thank you. We're getting close. So we want to just real quickly review the process to get a new REACH to Recovery volunteer into the program because, as I said earlier at the beginning of the call, I bet you know others who may be great Reach to Recovery future volunteer visitors. And the program is expanding. It is a major emphasis for the American Cancer Society to expand and offer more and more Reach to Recovery visits. So we will definitely need more and more volunteer visitors. So we're just giving you this information so you can help us and understand the process when somebody starts in the Reach to Recovery program as a volunteer visitor. So this new centralized nationwide process is now up and running for all new REACH volunteers. A potential volunteer may inquire about volunteer opportunities directly to the American Cancer Society through our website at cancer.org, through the National Cancer Information Center or the Patient Service Center, or through one of the local area offices. After that interest is expressed, they receive a program application and a pre-training self-assessment questionnaire, which is designed to help them determine whether or not Reach to Recovery really is the right volunteer opportunity for them. The Mission Delivery Specialist or their staff partner will interview the potential volunteer. Sometimes it's the volunteer coordinator, depending on the area, but usually it's the Mission Delivery Specialist that interviews them and guides them through into the Volunteer Learning Center website. The volunteer then completes a basic training curriculum on that website that consists of a few short videos, a couple of automated e-learnings, and a 2-hour teleconference that helps them practice their first visit through role-playing. Many of you, when you went through your training, had that role-playing happen live through a local office. Some of you did it over the phone as it was done in certain parts of the country. But nationwide, everybody gets a chance to practice their Reach to Recovery visit before they have their first patient. And that also helps them determine whether or not, again, Reach to Recovery is a good fit for them at that time. After they go through that training process, then they can begin serving in their new volunteer role. Obviously, this is a pretty simplified explanation of that in the interest of time, but just please understand that all new volunteers going in the program receive a lot of training and a lot of support, and so you can feel confident, hopefully, in recommending that others try the program. And of course, at any time, if it's not right for them, they can opt out. So they get to learn that as they go with the training process. Next, we're going to talk about how we promote the Reach to Recovery program. The American Cancer Society is very eager to promote and does promote Reach to Recovery every day. Our goals are, of course, to position the American Cancer Society as a trusted resource for patients, healthcare professionals, cancer survivors, and their caregiver. Increased awareness of the Reach to Recovery program is one of the many ways that the American Cancer Society can help patients and help their doctors and their hospitals support them through their cancer journey. So we actively reach out to healthcare providers to let them know about Reach to Recovery so that they will refer patients to the program as needed. We want to always increase the awareness of the Reach to Recovery program amongst existing breast cancer survivors, again, so that we find more volunteers just like you to help with this awesome program. We want you to know that the American Cancer Society has a brand new communication plan, including new and exciting strategies to promote the program, such as local staff working with their individual hospitals and clinics, integrating REACH messages into our other American Cancer Society events, such as our Making Strides Against Breast Cancer Walk and our Relay for Life events. We have a media outreach, including placement on social media, such as Facebook, Twitter, LinkedIn, and Google+. So we are expanding into the digital age a lot of Reach to Recovery program materials. We also have newly created promotional materials for staff that promotes the Reach to Recovery program. And we know that in some areas Reach to Recovery hasn't been very busy lately, and many of you have done a fabulous job of promoting Reach to Recovery in your local community. And you certainly can continue to do that. However, it's important that you coordinate these activities with your mission delivery specialist especially when it comes to hospitals, doctors' offices, and clinics, because that is a prime area where staff is already promoting Reach to Recovery. So it's not that we don't want you to help promote it, we just would like to coordinate those activities so it's done in conjunction with your staff partner in your local area. So that's another great reason to reach out to your local staff partner. If you've already been promoting Reach to Recovery or you want to do more of it, that's a great thing to partner with your staff partner as well to generate more and more patients finding out about the awesome support that Reach to Recovery can provide. And I'm going to turn it back over to Ann, and she's going to talk a little bit about recognition within the Reach to Recovery program.
Thanks, Elisa. This is what I always refer to as the happy part of the training program, and that's the Tree Slasser Memorial Award. Each of you as a Reach to Recovery volunteer are the backbone of the program. Your Mission Delivery Specialist staff partner will support you and recognize your contributions to your role. It's really exciting to share with you all today some information about the Tree Slasser Award. I'm so delighted that it has not gone away. It might be something you're already familiar with in your area. I was delighted to coordinate the award selection for Ohio and Pennsylvania last year, and it was just a terrific responsibility, but just such a rewarding thing to be able to see all of our volunteers get recommended for this award and then to be able to congratulate the final winners. A little bit of history. Following her own breast cancer experience in 1952, Tree Slasser began the Reach to Recovery program. In 1969, the American Cancer Society adopted the program as one of its nationwide programs. The Reach to Recovery program's Tree Slasser Memorial Award is presented annually to an individual or group in recognition of outstanding contributions to the program. The recipient may be an individual or a medical professional, but is not required that they be affiliated with the American Cancer Society. To maximize opportunities for volunteer recognition, there will be one Lasser Award winner for each state. The awards will be distributed each year during National Breast Cancer Awareness Month in October. And just to remind you, here are the criteria, the award criteria. Demonstration of adhering to Reach to Recovery standards and guidelines. Activities that impact the community served, and contributions to the evolution and growth of the Reach to Recovery program. If you're interested in learning more about recognition in the Lasser Award, please refer to your manual or contact your local staff partner. We had some discussion on it when we were creating the slides, and I believe that's an actual picture of Tree Slasser, but maybe Elisa can tell us.
It is an actual picture of Tree Slasser.
Oh, that's fantastic. I'm so glad you found one. And now I'm going to turn it back over to Elisa to wrap up for us.
Thank you. Thank you. Awesome. And thanks for hanging with us for this update training today. Just to give you a little bit of a timeline of where we're at going forward. Right now, and as we're recording this today, this is the middle of May that we're recording this presentation for you today. So right now we're in phase 1. That means we're getting all current American Cancer Society staff and volunteers trained on the new Reach to Recovery program standards with a target date that across the country we will all be utilizing these new standards at September 1st, 2014. This means that all Reach volunteers need to be trained and ready to practice and implement these standards by September 1st, 2014. So if you know other Reach volunteers that haven't done their update training, do your best to help us and remind them so everyone gets this update training and on board by that deadline. That is when our new Reach to Recovery standards go in effect across the country. And until that time, the American Cancer Society local offices, divisions, states, however it's divided up, they are continuing with the current processes as we phase in these new processes to be ready by September 1st. Phase 2 will include an evaluation plan, more recruitment, selection, and training of our national trainers and mentors, and the rollout of new advanced stage and recurrence breast cancer volunteer training. So just to review what's on the slide right now, Early support and advanced and late stage, early support will be implemented when the new standards to go into place September 1st. If areas are not offering that now, starting September 1st, those matches will start to be offered. Again, remember, you should feel comfortable with the match that you receive. So if some of these new areas of match are not what you're comfortable with, you don't have to accept a visit. And then later on, in late 2014, there will be training for recurrence or late stage or metastasized breast cancer. So late 2014 or possibly early 2015, that training will be available. Starting September 1st, you may receive a match that asks to have an email visit. Again, it's up to you whether or not you want to accept that match, but that's when those will start coming through. Everyone across the country will be utilizing the new completed visit form and turning that in within 5 days after the visit. And then we are starting the new volunteer Reach to Recovery training on June 1st of this year for brand new volunteers who have been waiting or coming into the program. They'll be phased in starting June 1st. And then the new Reach to Recovery volunteer positions we talked about, the national position and the mentor position, those are going to come in later this year, late 2014. So now that we've covered, we're almost done, but we're just wrapping it up here. We've covered our new nationwide standards and guidelines. I'd like you to take a look at the piece of paper that you've been jotting notes on during this training to see if there's any questions that we did not answer for you today. We hope that we did. We tried to be as complete as possible, but if there's something you're not clear on, the way we phrase something or something you feel like we left out, now is the time to take those notes and contact your local American Cancer Society staff partner. And again, if you don't know who that is, you can call 1-800-227-2345. Let them know where you live, what your zip code is, and they will quickly be able to tell you who your mission delivery specialist is. And I want to just take this time on behalf of Ann and myself to thank you once again for your service to the Reach to Recovery program. Breast cancer patients, wherever they are along the breast cancer continuum, are serviced by this program each and every day through the support of wonderful volunteers like yourself who have paid it forward, paid it back after your experience taking that and helping others along the journey. You guys are all heroes in my book, including you, Ann. Thank you for your time today helping with the training. And we're going to sign off now. Ann, go ahead and say goodbye to the group. Thanks for attending the training today.
Thanks, Elisa. You made it very easy for me. I really appreciate it. And thank you all for your continuing service to the American Cancer Society and the Reach to Recovery program.
Bye-bye.